All right, boys and girls, welcome to the eye. Here it is in all of its glory. I'm going to point out some things. You're just required for whatever it is I have on your lab sheet. That's all you're required to know. I may just start pointing out stuff though. But here we have, the palpebra, the eyelid, right? Around the eye, we have the lacrimal gland over here on the lateral side. We know this is lateral because here's the nose. Okay, been removed. So here's the palpebra, the lacrimal gland, the superior, the levator palpebra superioris right here. And then underneath that, a little bitty spider, right there underneath the levator palpebra superioris, we have the superior rectus muscle. And you can also see there's the inferior rectus muscle right there. And you can see right there is the superior oblique. Right here, I've removed the muscle, but right there where my pencil is, that would be the lateral rectus. And then deep inside right there is the medial rectus. And then here you can see this muscle belly right here. It goes underneath and the tendon runs at an oblique angle, and that's the inferior oblique. This right here, this little white structure, this is going to be your optic nerve. If I bring it around to the front here, take this off, and I'll just take this muscle belly off as well. Now we can see the white of the eye, and that is sclera. We have a modified portion of the front of the sclera right here, this clear part. That is the cornea. You see the blue colored part. That's the iris, and then the dark circle in the center is our pupil. Pretty easy. If I take that off, there's the cornea that just popped out. Okay. If I leave this right here for a second, okay, you can see that there is a divot there, a space in between the front of the iris, trying to get that to focus in, the front of the iris and the back of the cornea. That's going to be your anterior chamber of the anterior cavity. In front of the lens, which is right there, and I'll pull this apart here in a second, there's a tiny little space that exists, and that's going to be the posterior chamber of the anterior cavity. All of this right here, this purple, all of this is your choroid. It houses all the blood vessels, and there you can see all the blood vessels associated with the eyeball, or most of them. But this whole purple aspect right here is going to be the choroid. If I take this thing, I'm going to hit pause because I'm going to have to open this up. Okay, I have taken that eyeball and opened it up here. And here you can see the suspensory ligaments, those white little dudes right there. Here's the lens right here. If I remove it, there it is. You can see it just sits right there, and there's the lens. And the suspensory ligaments are what pull on the lens and help to change its shape. Okay. I'm going to move that to the side there. On this model, you don't necessarily have a very good view of the ciliary body, and that's going to be my fault for grabbing this model. But when you look at it on cross section, the ciliary body is the muscle and the ligaments together. And for all intents and purposes on our model, let's just call this the ciliary body on this model. Lastly here, there's a few things. If I take this out, okay, if I take this part out, this right here is representing the posterior cavity. The posterior cavity is the totality of the whole space here that is behind the lens. All of this structure right here that I'm rubbing on, all of this is the retina. And on the retina, we have a couple important spots here. We have a couple important spots. One you can see right here, hopefully. It's that white area right there. This is where all of the nerves congregate and exit the eyeball. So on this side, this is your optic disc. It's your blind spot. On the other side, it's referred to as the optic nerve. So here it's the optic disc, that white thing, and there it is right there. There's your optic nerve, okay? Two other structures that we have in here, and I'm going to try to get this in, slowly come on in. You can see we have that kind of this yellow sunburst right there. Okay, hold it with my other hand. There you go. There you can see that yellow sunburst, and hopefully it'll come focus in here in a second. There it is. That yellow sunburst is what I'm talking about. That is the fovea centralis, that yellow bitty spot. Around the fovea centralis, that yellow little spot right there, is a slightly, it's a slightly discolored region, kind of reddish, right around it. And that's referred to as the macula lutea. The fovea centralis is the highest concentration of cones. It's where your greatest visual acuity is. And the area around it is referred to as the macula lutea. A higher concentration of cones, but not the highest.